it is the presenter's laptop, sound check, presenter's laptop, sound check, and clerk's laptop, sound check, clerk's laptop, sound check, and we are back in pre-meeting. So, clerk's laptop, sound check, clerk's laptop, sound check, presenter's laptop, sound check, presenter's laptop, sound check. And we are So Tamara, we are live, and it's presenter's laptop sound check, presenter's laptop sound check, and laptop sound check, clerk's laptop sound check. So that's sound check 3 for emergency and community services at 1:12 p.m. And we are in pre Meeting is in progress. Clerk's laptop, sound check. Clerk's laptop, sound check, 432. Laptop, sound check, 432. Presenter's laptop, sound check, ENCS. And we are in
for 7th to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and media may also be audibly or visibly recording this meeting. All electronic devices are to be switched to the non-audible function during committee meetings, and a reminder that members have 5-minute time limit for speaking, at which point if you go over that time, I'll invite you to come on as a second time to finish up your questions and or comments. Please note that quorum is present. Councillor Whitehead is away on an approved leave, and Councillor Marula is absent. Okay, are there any changes to the agenda today?
Yes, Madam Clerk, there are a number of changes to the agenda. Under item 7, consent items, we have added item 7.4, added item 7.4C under various advisory committee minutes. We have the Seniors Advisory Committee minutes for September 10th, 2021. We also have added item 7.5, Seniors Advisory Committee Citizen Committee Report, funding support for the International Day of Older Persons. We also have under item 9, public hearings and delegations, Tom Cooper from the Hamilton Roundtable for Poverty Reduction, respecting recent community forums related to extreme heat in Hamilton. The delegate has asked to postpone his delegation until the spring, so won't be appearing before us today. Then under item 13, general information and other business, we have some further amendments to the outstanding business list under 13.1. We have 13.1B, items considered complete and to be removed. 13.1BA, the encampment legal brief, which is item 20B on the OBL. It was addressed at the General Issues Committee, item 14.5 on the August 9th, 2021 agenda. Then we also have item 13.1BB, accessing capital repair funds from the National Housing Strategy Co-Investment Fund for CHH. It's item 21B on the OBL, and it is being addressed as item 10.2 on today's agenda.
Thank you so much for those changes. May I please have a mover and seconder to approve the agenda? Moved by Councillor Paul, seconded by Councillor Clark. Any discussion on the agenda as amended, colleagues? If not, we'll move to the electronic vote. Should be up momentarily. And a reminder as we move in second reports to use the speaker's icon on WebEx if it's working for you. The vote should be coming up just a second, folks. The vote is there. Councillor Pauls, are you able to see it? Came through? Great. And that carries. Moving on to declarations of interest. Colleagues, any declarations to declare or interests to declare? Seeing none, move on to item number 4, approval of the minutes of the previous meeting of September 9th. May I please have a mover and seconder to approve those meeting minutes? Moved by Councillor Jackson, seconded by Councillor Pauls. Any discussion on the minutes? Seeing none, we'll move to electronic vote. And that one came up nice and speedy. And that carries. Moving on to consent items. Item number 6.1 is the Residential Care Facilities Liaison Update number 5. If I may please ask staff to provide a brief introductory overview, and then we'll open it up for discussion on 7.1.
Good afternoon. Through you, Madam Chair. This RCF information update, which is the 4th quarterly update, gives an overview of the concerns that have been coming in to the RCF complaint phone line and email. And as a result of a previously approved recommendation report, this position or this rule, temporary in nature, will continue on through till the end of 2021.
Thank you. Councillor Clark.
Oh, thank you. My microphone was on. Good thing I didn't say anything silly. So when will the report, after reviewing the report that is before us, it's clear that you're reviewing the position to see whether or not we should continue with that type of position? When would that report come back to this committee?
I'm going to defer that to Grace Mader, if that's okay.
No problem. Hi,
Good
Grace.
afternoon, Grace Mader, General Manager, Healthy and Safe Communities. Through you, Madam Chair, to Councillor Clark. We're in the process of determining how best to do that. We have absolutely seen the value in having this continue, and we're just looking at how best to make that happen. So we will be reporting back by December.
So, Chair, can I ask Grace if there is a way to ensure that the position, the role, the work that's being undertaken would continue until we actually get your report back? I'm worried about having the
Yep.
position elapse, and then it's a role that has been serving a valuable service to the folks that are in these residential care facilities. So I'm nervous that there's going to be a separation somehow, that the role is going to end because of a technical issue, and then we're not quite done with our report, and so we end up with this time lag. Can I be assured that that's not going to happen?
General Manager?
Through you, Madam Chair. Absolutely, Councillor Clark. We've made the approval for Ricky to continue with her role until the end of December. So we'll be back to you prior to that with what the next step's going to be.
That's
so
excellent.
There'll be no lag.
Super. Thank you very much. I appreciate that. Thank you.
Thank
Thank
you,
you, Madam Chair.
Councillor. Yeah, no worries. And just a reminder that we do have a request for staff to identify themselves for the public record. So thank you, General Manager. And Ricky, if you don't mind, again, just for the public record, stating who you were. And thank you so much for that overview.
My apologies for that. I'm Ricky Frith. I'm a project manager within neighborhood development, but I'm also redeployed supporting the RCF temporary liaison role as well as EOC scribe.
Thank you so much. Okay, so motion to move and second to receive the report. So moved by Councillor Clark, seconded by Councillor Jackson. Should be before you electronically to approve the report. Sorry, receive report. And that carries. Thank you. Moving on to early years update, report HSC 21037 citywide. I'd like to call on Jessica Chase, Director of Children's Services and Neighborhood Development, to give a presentation respecting the early years update. Jessica, if I could.
Thank you. Through the chair, I'm Jessica Chase. I'm the Director of Children's Services and Neighborhood Development Division. And I'm bringing forward this report today to provide an update on our early years and childcare system. Like many other sectors, the early years and childcare system has been impacted by the pandemic. Our childcare and early years operators have continually adapted and put in place enhanced health and safety measures, including most recently vaccine disclosure policies, all while continuing to focus on ensuring that they're providing high quality and welcoming environments for children and families. At this time, all childcare programs across the city are open and operating. However, many of our operators are continuing to operate at a reduced capacity. And you'll see in the report that we have seen some improvements in that area. However, many are still not at their pre-pandemic levels, as well as many of our operators across the system are experiencing some staffing challenges, and that's a result of a shortage of registered early childhood educators across the province. So to support the recovery and sustainability of the system, our division has identified 4 key priority areas going forward. The first is the recovery and sustainability of our system, with a particular focus on supporting operators that have been impacted by reduced capacity or prior closures of childcare centers. The second is looking at affordability for families, including the continuation of the affordability plan, which reduces the cost of childcare by $10 a day. The third is looking at equity, diversity, and inclusion. And the fourth is looking at staff retention, recognition, and well-being initiatives. Lastly, I did just want to highlight, and you'll see in the report there, that we are still waiting for additional details on the National Childcare Plan, but have aligned the priorities that I've identified in this report with the priorities that were identified in the federal budget. And when we do have additional details on that plan, we will be coming back to council at that time with more information. Happy to take any questions.
My apologies, I was muted that whole time. Thank you, Jessica, for covering me. Thank you so much, Director. Any questions, colleagues? Seeing none, we'll move to receive the report. Thank you so much. Moved by Councillor Paul, seconded by myself. An electronic vote should be before you. And that carries. Thank you very much. Moving on to 7.3, physiotherapy services, report HSC 2107040 in wards 7 and 13. Any discussion on item 7.3, committee members? Councillor Jackson?
If Councillor Pauls wanted to go first with one of the homes being in her ward, that's fine, but I just had a question for Holly. Thank you.
Okay.
No, I just wanted to move it. I read it and I talked to Holly and everything's good. Go ahead, Council.
Thank you. So we'll move it by Councillor Pauls and seconded by Councillor Jackson when we get to that point. Councillor Jackson, the floor is yours for your question.
Thank you, Chair Nan, and thanks, Councillor Pauls. Appreciate that. So just through you to Senior Administrator Odiarty, Holly, this is procurement of physiotherapy services for both Wentworth Lodge and Macassa. You want an extension here of 18 months through the single source. Looks like Hamilton Physio Clinic have been a long-standing provider of this service, and I take it for continuity's sake, you want this hopefully to continue. And it sounds like somewhere down the road, year and a half, 2 years down the road, you'll further work on some form of competitive process. If you could just comment in terms of how I've interpreted this. Through you, Chair Nan, please.
Absolutely. Go ahead.
Through the chair, Holly O'Dwardy, Senior Administrator, Macassa and Wentworth Lodges. Through you to Councillor Jackson, you have interpreted that report very well and very succinct explanation of that. Thank you.
Okay, fair enough. I'm happy to second it. Thank you.
Excellent. So it's been duly moved and seconded. Seeing no other questions, we'll move to a vote. And that carries. Moving on to 7.4, it's the advisory committee minutes of 7.4A, the Housing and Homelessness Advisory Committee, both the February 2nd and March 2nd meetings. The 7.4B, LGBTQ Advisory Committee, for the first time on this committee's agenda for approval, given that change that's been ratified through council for their minutes of August 17th, 2021. 7.4C, Seniors Advisory Committee, September 10th meeting. Any discussion, colleagues, on the advisory committee reports before us? Councillor Jackson?
Thanks, Chair Nan. So just on 7.4C and the second Seniors Advisory Committee report, I believe that's an action item that not just to receive, but they require this committee's approval for the $500 that they spent for October 1st, the International Day of Older Persons event that several of the reps attended. So I just want to make sure procedurally that just didn't get received, but to show our support, we adopted it. Thank you.
Most certainly, Councillor Jackson. That's on item 7.5. So it came forward as a citizen committee report, and those items that are for our endorsement and or approval come out as separate items from the committee minutes. So absolutely, it is there. Thank you for that. So seeing no further discussion on the advisory committee minutes, may I please have a mover and seconder to approve, receive these advisory minutes? Moved by Councillor Clark, second by Councillor Pauls. And we'll move to an electronic vote. And that carries. Moving on to item 7. Here's Advisory Committee Citizens Committee report on the wonderful preamble already given by our colleague, Councillor Jackson, who will move it. I will happily second it. Funding support for the International Day of Older Persons. Any other discussion on this item? Seeing none, duly moved and seconded, and it is before committee for approval. Thank you. That one also carries. Moving on to discussion items. Item 1, Electronic Patient Care Record System Standardization, Report HSC 21035. May I please have a mover and seconder to put the report on the floor? Moved by Councillor Paul, second by Councillor Jackson. And now that it's been put on the table, I'd like to call upon Chief Michael Sanderson, Director of Paramedic Services, to please provide a presentation respecting the electronic patient care record system standardization.
Thank you, Madam Chair. And for the viewers, it's Mike Sanderson. I'm the Chief for the Hamilton Paramedic Service. So, Madam Chair and members of committee, thanks for the opportunity to speak to the report, which addresses continuation of our long-standing partnership with InterDev Technologies, who are our contracted patient care report and data consolidation provider. InterDev was a successful proponent to a 2009 RFP process to provide electronic patient care reporting. Our transition to electronic reporting was fully completed by 2015. We've been fully implemented using InterDev Technologies for several years now, with more than 500,000 patient care records in our database. That reduces physical file storage, requirements and processes for managing those, and improving our quality improvement activity, including call audits and direct feedback to the paramedics. In 2016, Council approved a 5-year extension of the contract and the sole provider arrangement. We've continued to develop the relationship and to leverage the InterDev technologies to improve performance. The ability to fully analyze our data, including the now integrated Ministry of Health ambulance dispatch data, has been extremely important for quality improvement activities and in enabling our performance and development team to better determine what the most essential training opportunities are for our paramedics. It has also driven technology improvements which benefit the patients that we serve. The data availability has enabled better identification of patients who are frequent system users and those who may benefit from the community paramedicine or the social navigator program interventions, thereby reducing some of our response demands. Summary information is also shared with public health to assist in identification of trends such as the opioid overdoses we've been dealing with for the last few years now, and various other social determining factors, including violence in residential areas. Since our initial implementation, we've expanded the use of technology with the implementation of the CAD-Link program, another product from InterDev, which now provides full view of the Ministry of Health's dispatch information to the responding paramedics, including full scene information, caller information, and safety alerts. The CAD-Link further provides routing information using current map overlays and call data as an additional resource to the existing Garmin devices and to our map books. We continue to work with the vendor and the Ministry of Health to move forward with two-way data exchange, which will again reduce the need for further voice contact and data entry on the dispatch side, aiding their performance. We've also moved forward with the establishment of and then the improvement of the situational awareness dashboard. The SAD not only provides us current real-time operational awareness to frontline supervisors, thereby assisting them with their activities. It's also shared with the Ministry of Health dispatch to assist in balancing patient distribution to hospitals, and it's shared with the hospitals to create transparency and awareness of our operational challenges. And of course, it's shared with all of our managers to provide analysis and focal points for discussion. Over the last 18 months of dealing with COVID, this resource has been particularly invaluable to our operational activities, particularly with the identification of suspect COVID patients at the time of dispatch and then at the responding paramedic level, so we have a better awareness of what's going on with that process. In summary, the technology in place with InterDev Technologies, our movement forward to further integrate and to leverage electronic data, and the willingness of InterDev as a partner to further create and to develop opportunities for improvement is very important to our service delivery. So I would thank you for the opportunity to discuss the report, and I'd ask that you recommend approval of it for implementation. And of course, either myself or Cliff Eggleton, our Executive Manager for Logistics and Support, are available to answer any questions that you may have. Thank you, Madam Chair.
Thank you for that overview, Chief. We have Councillor Clark on the speakers list. Councillor?
Thank you. I appreciate the opportunity. Just one question. With regards to the standardization process, so and it's not specific to this license, but I have this ongoing concern that as we standardize products and say we're only going to be buying this brand or this service from this, that at some point we end up paying a penalty with an increase in costs that we have no way of mitigating. So what checks and balances are in place that after the 5-year time period that we don't find ourselves with a software system that has been standardized by policy and we end up experiencing a significant increase in cost?
Through you, Madam Chair, that's an excellent question. It's one of the things that we wrestle with on an ongoing basis. How do we end up standardizing the process and make sure that we're not digging ourselves into a position where we can't extricate ourselves? The challenge for us in terms of the InterDev technologies is they're the only provider of this specific ambulance patient care software or patient care software that we deal with. There are other vendors out there, but a transition over to another vendor at this point in time, or potentially at a future point in time, would necessitate retraining of our paramedics, reconfiguration of our computers, and probably some significant expense in terms of doing that transition forward. I think in answer to your question, Councillor, we've committed to coming back to Council each 5-year period as we're going through a 5-year contract. You could expect us to be coming back with a 5-year review and a recommendation, and certainly we keep our eyes on, and I know Cliff Eggleton keeps his eyes on, what the costs are for other potential alternatives for the patient care devices, for the emergency patient care data. So the challenge for us at this point in time is we would have to have a sense, and we've been looking at this for a period of time, that there would be a cheaper alternative that would not be onerous and overly costly to implement in terms of the process. And that's just not there for us right now. It may be at some point in the future, and we would certainly have to look at that and be aware of it. So our commitment is to come back to Council at that 5-year interval.
Thank you.
Yeah, and I appreciate that, but I'm seeing a 3% increase annually, and yet inflation is not running at 3%, and so I'm going to support it, Chief, but I'm really wanting staff to make sure that we have some checks and balances, that the municipality isn't taken for granted, and we find ourselves in a situation with increased costs that we didn't anticipate, and now we're boxed in. We have no way of extricating ourselves. So it's just a caveat at this moment, but that is the risk that we incur when we begin to standardize specific software or products. We create a situation where no one else can provide what we have, and so the premium goes up, and as a result, we find ourselves in an awkward situation 5-10 years from now. I likely won't be here, but others will, so I'm just raising that as a caveat for staff to keep an eye on. Thank you.
If I could, Madam Chair, thank you very much, Councillor, for that, and I appreciate the concern on it. The one thing I neglected to identify as part of the cost increase, and it is covered in the report, is related to the number of paramedics that are using the system. When our initial contract came with InterDev technology, it was based upon a fixed number of paramedics, and it actually is a sliding scale, and they'll be looking, I expect, to correct that to a sliding scale for the number of paramedics within our system, and that's why we've anticipated a potential 3% increase. It's about the number of paramedics we've increased since we first went into the contract with them.
Thank you for that. Thank you, Councillor Clark. Any other questions on this report? Seeing none, we'll move to the vote. And thank you again, Chief, for the overview and the responses.
Thank you, Madam Chair.
And that carries. Moving on to item 10.2, accessing Care Funds National Housing Strategy Co-Investment Fund, City Housing Hamilton, Report HSC 19048B, citywide. I'd like to call on Edward John, Director of Housing Services, to give a presentation respecting Access and Capital Repair Funds, National Housing Strategy Co-Investment Fund for the City Housing Hamilton.
Thank you, Chair. And once again, it's Edward John, Director of Housing Services. I'm pleased to provide an overview of the report before you. It catalogs the development over the past 2 years that both the City and City Housing Hamilton that have been working on the application for funding through the National Housing Strategy Co-Investment Fund, delivered by CMHC. The funding itself is a unique funding opportunity. It allows municipalities to navigate through repair projects on a portfolio basis as opposed to focusing on individual buildings. This provides the ability to ensure that we have cost metrics in the procurement of certain items, as well as labor and materials, and obviously get some cost efficiencies across through that process. Through this work, City Housing Hamilton has planned $194 million worth of repair projects, and this will impact over 6,000 units across the portfolio. Through this process, it will receive $87 million in repayable loans from CMHC and $58 million in forgivable loans over this work over 8 years. Currently, CHH estimates its capital repair needs over the next 20 years to be approximately $400 million. Therefore, as the provider with the largest stock of affordable housing in Hamilton, the $145 million proposed in this funding agreement will help to meet some of CHH's capital needs, relieving some of the resulting capital pressure on the city, and obviously allowing for the procurement efficiencies as previously mentioned. Despite this funding, it should be noted that it will not resolve all those capital needs for City Housing Hamilton. The outcomes of the National Housing Strategy actually require us to focus on certain repairs. These repairs must improve the affordability, energy efficiency, and accessibility of the housing stock. So projects within scope of the funding were planned to generate improvements in only those areas. This funding will also not create new units. The funding is very much programmed towards the repair approach. Funding is also specific to the CHH portfolio only and will not address the capital needs of other housing providers. However, we continue to try and maintain dialogue and discussion about the potential of expanding this to those other providers. Finally, the recommendations in the report today outline some of the key steps next in moving towards the finalization of this agreement and the execution and receipt of those funds. It will require permission from the GM to enter into the agreement. It establishes an agreement between the city and CHH. It provides consent to CHH, as we as service manager require that to secure properties for CHH and the city, and to use annual payments of retired CHH mortgages to support CHH in repayment of repayable loans back to CMHC. On this basis, I conclude my presentation. I'm happy to answer any questions. We do have a number of staff here too to also assist in any of those questions should they arise. Thank you.
Thank you, Director. I see Councillor Clark on the speakers list. Just a quick check procedurally. Clerk, do I need to move and second the report for the speakers list to be activated? To put it on the floor. Thank you so much. So moved by myself and, oh, no, I can't do that because I'm the chair. So moved by Councillor Jackson, who is also on the board, and seconded by myself. And then Councillor Clark, please proceed with your questions.
Thank you. And so we have a number of housing providers that do not fall under this envelope when we're dealing with city housing. Is that correct?
Through the chair to the council, that's correct. This agreement would apply only to the portfolio under City Housing Hamilton. At the onset of discussions with CMHC, we raised that. Obviously, CHH currently have approximately half of a social housing portfolio, so we do have many other providers in similar needs of repair and maintenance scheduling for those properties, and we raised that and continue to raise that. Initially, they wanted to secure, obviously, the largest provider within Hamilton, and they have continue to suggest they will look beyond that once we've received this and move forward to the next phase.
So the decision on which units were being moved forward were not based on their actual state of repair. It was based on CHMC's decision to move forward with the city housing Hamilton stock first. Should I get that right?
Through the chair, their decision was based on their ability to have less agreements with the largest housing provider. With respect to Housing Services' ability to determine which buildings. Obviously, we worked with CHH and CMHC to determine with the funding which projects needed the funds most desperately in terms of their state of repair. They did have to fall into those three categories: accessibility, affordability, and environmental. And so, out of approximately 7,000 units, 6,000 are being in some way improved through this process. However, there will likely be additional costs associated with the repair and maintenance to touch upon those matters that weren't dealt with.
And is that intended to be a next round through CHMC, or are we expected to pay that bill?
Through the chair to the councillor. So for those units which still require repair not improved through this process, the expectation would still remain with the individual housing provider to deal with those repair requirements. And in this particular situation, as Housing Services, we work with our providers to determine what is their approach to repair and maintenance, and then work to ways to which to make it financially feasible.
Thank you. I appreciate that explanation.
Thank you, Councillor Clark. Thank you, Director. Colleagues, any other questions? I will pass on the chair to Councillor Jackson so that I can make a couple of comments and also clarify, if I may, please.
Floor is yours, Councillor.
Thank you. My comments are partly as the treasurer for CHH, as well as having paid attention to this file. So through you, Director John, this is the result of CHH putting forward their application to CMHC for their repair of the entire portfolio, that these funds have been prioritized by CMHC. Not dissimilar to that which Toronto did with Toronto Community Housing, correct?
Director?
Through the chair to the councillor, that is correct.
Thank you. And so, colleagues, with this going forward, it's a tremendous opportunity, as stated in the report and overview by Director John, for CHH to bring online much needed repairs, but more importantly, units that have sat vacant that could otherwise go towards those residents in our community that are in that affordability bracket, that are also looking for units that are more accessible. So it does give CHH an opportunity to update our portfolio, address some state of good repair, but most importantly, ensure that the units that are sitting unoccupied right now are going to those residents in marginalized situations and on our wait list, and make sure that those units are brought online and housing people safely. And did want to emphasize again, it's not new units, it is refurbishment of existing units, which then goes and fits within CHH's overall development portfolio plans as well. So I'll take the floor back. I have no further questions. Councillor Jackson, thank you so
Chair,
much.
back to you, Councillor.
Duly moved and seconded, and it is before you for approval. Thank you. And that carries. Wonderful. Moving on to item 11, motions. Motion 11.1, youth violent crimes. Councillor Clark, may you please introduce your motion respecting youth violent crimes that's moved by yourself, and I'll happily second it. Go ahead.
Thank you, Chair Nan. I appreciate you seconding the motion. I want to read it into the public record first, and then I'll speak to it very quickly. Whereas the city of Hamilton is experiencing several incidents of gun violence across the city, whereas it has been reported in the Hamilton Police Services 2020 Youth Services Annual Report that there has been a decrease in youth violent crimes compared to 2019, it is recognized that this is still a serious issue in the city of Hamilton. Whereas Hamilton Police have indicated that the vast majority of youth violent crimes are targeted, and whereas residents have expressed concern about the risk of the injury to innocent bystanders, therefore be it resolved that staff from Healthy and Safe Communities Department be directed to review projects like Operation Ceasefire and other holistic community responses that were designed to deter youth from joining gangs and holding guns. B, that staff be directed to engage youth to to inform the process and partner together to address the issues that are driving our youth to guns and gangs. That staff invite the Ontario Solicitor General, Hamilton Police, youth workers, clergy, criminal justice practitioners, and other experts to identify solutions to create a citywide action plan response to guns and gangs in our community. That staff be directed to include a citywide action plan response to guns and gangs in our community through Hamilton's youth strategy. That staff be directed to share any data specific to guns, gangs, and violence through our 2021 re-engagement for the youth strategy. And F, that the city-wide action plan response to guns and gangs in our community be created in collaboration with and incorporated into Hamilton's community safety and well-being plan under the priority of violence. Chair Nan and colleagues, I have been contemplating this motion for many months now. I have spoken with many of you, not all of you. I have spoken with clergy in our community, police officers, residents, both above and below the mountain. And I can tell you that overwhelmingly there is a concern in the community about the number of gun crimes that are occurring and the number of sharp weapons crimes that are occurring and the involvement of our youth. More recently, there was a shooting in Upper Stony Creek. 3 people were shot. One, a 17-year-old boy, was killed. And I say boy because at 17, you're still a kid. And so this young man, and we may not know for some time as to what exactly transpired, but this young man's life was cut short unnecessarily. And it's happening across our community. It's not just happening in the downtown. It's not just happening in certain wards. These issues of gangs and drugs and the proliferation of gun crimes, although targeted, still risks our broader community. And regardless of who is killed in these shootings, they have families, they have lives. So what this motion seeks to do is not to solve the problem, but to certainly reach out to the broader community and come up with a holistic approach in terms of how we can deter young people from getting involved with gangs and selling drugs and ultimately carrying guns. What I have learned is that they can make a lot of money selling drugs on the black market, and then they end up holding the gun to protect themselves. We have to reach out to the youth to ensure that they understand that there are wiser, better ways to make a living in the community and how they can protect themselves and their families. So what I'm suggesting here is that we really have a good consultation and we create, much like many years ago in the United States, I believe it was Chicago, who had incredible gun violence, created Operation Ceasefire. We create a Made in Hamilton program that will help deter youth from joining gun gangs and holding guns. That is the complete intent. I left it on the docket as a notice of motion at the last meeting to ensure that everyone had an opportunity to review it. And we're ready now to move forward and see what we can come up with. I thank you for your time. I thank you, councillors, for your consideration of this motion, and I do hope that you will support it. Thank you.
Thank you, Councillor Clark. Any other committee members have comments or questions? Councillor Pauls, and then I'll add myself to the list and alert to Councillor Jackson. Go ahead, Councillor Pauls.
Thank you, Councillor Clark, and it's a well-needed motion, and I do support it. But is this asking the city to create their own, or are we involving other organizations that help in this matter with gang violence and with the youth? And so I just want to be clear. It's not something that the city is going to create. and we have it under our portfolio, or is it getting everybody involved and give it to the other providers that do that?
Councillor Clark,
Madam
is that
Chair,
for you, please? Yep.
I think so. The intent is not to create a new program somewhere in the city of Hamilton. The intent is to create a holistic program that would encompass the entire city. And I forget which paragraph in the resolution it is, but we really are talking about involving people who really understand and may have small programs already up and running. My apologies for that. May already have small programs up and running, to Councillor Paul's point, that we could learn from. The hope is that we will create, as I said, a made in Hamilton solution where all of the parties come together and work together to create the deterrent.
Thank you for that explanation. Thank you, and I support it.
Thank you,
Thank
Councillor
you,
Pauls.
Councillor.
If I may pass the chair over to Councillor Jackson. I have
You
a
have the
couple
floor,
of questions
Councillor Nan.
as well as statements. Thank you so much. Through you, if I could ask staff who are responsible for the youth strategy and some of the intersection that's spoken to in this motion, is this work currently integrated in the youth strategy in any scope?
Who's with us here? General Manager Mader or whoever on your staff, please.
Good afternoon. It's Grace. I'll start it and then I'll pass it over to Jessica. Grace Mader, General Manager for Healthy and Safe Communities, through the chair to Councillor Nan. Last March, we had been just in the process of bringing forward with our youth strategy right at the start of the pandemic. That was tabled as along with the majority of our work at that time. And as we started to relook at it last fall, we realized that the impact on the pandemic had been staggering on youth. And we really felt that we had to go back to square one and relook at it. So when Councillor Clark reached out about this potential motion, it really aligned with not only the work that we were relooking at an engagement process for our youth strategy, but also was aligning with the work that we were doing under our community safety and well-being plan with, as he mentioned, the priority on violence. So we really think it's a great opportunity to go back out and engage our community partners and engage some of those new individuals and agencies and faith-based groups in this conversation as we move forward, and then we'll bring that back. We think it will be able to have a two-prong approach about not only with our youth strategy, but also on our violence priority under the Community Safety and Wellbeing Plan. Thank you.
Thank you. Thank you so much for that, General Manager.
Did you have anything to add?
Through the chair, just to add to that, and Grace has provided an excellent overview of some of the work that we're doing with the youth strategy. We have specifically, as we are going back out right now, we've been doing surveys and focus groups with youth, with parents, and with community partners. And safety has been one of the topics that is specifically being addressed throughout these sessions. So we really want to hear from the voices of youth and from community partners around what their priorities are and some of their ideas and solutions around this. So absolutely, this work aligns really well with the work that we're already undertaking around the youth strategy, as well as in collaboration with the Community Safety and Wellbeing Plan.
Thank you both for those responses. As anticipated, already integrated into both the youth strategy, phase safety focus, and then of course the safety and wellbeing plan that we saw presented to committee and council earlier this year. Second question through you, if I could, does speak to what General Manager Mader already mentioned, which is the impacts of the COVID-19 pandemic and specifically the impacts on young people. And some of the anecdotes and experiences and stories that have been shared with me in Ward 3 is a deep concern by community members and parents about the way in which young people have kind of slipped through the cracks of support during the pandemic, as different social service agencies had to pivot their operations in order to stay safe within public health guidelines, but unfortunately resulting in a number of young people getting disconnected from very life-affirming supports that many of our social service agency and not-for-profit organizations that focus on young people have been able to provide. And by nature of them being young people, not having their own means by which to reach out and connect with service providers and individuals that they had grown to have relationships of trust and support with. So from that perspective, definitely seeing young people falling through the support cracks, seeing a deep need in the Ward 3 community and across the city, as mentioned, the need for healing and understanding and contextualizing COVID-19 and the impacts on mental health and self-security and self-worth, the need for growth, the need for positive reinforcement, the impacts of increased poverty, the slipping of the cracks for marginalized individuals and those who come from marginalized families, whether because of their immigration status, their refugee status, whether it has to do with their income levels, seeing a lot of young people really in anguish and languishing throughout the city. And, as Councillor Clark mentioned, it's not just a one particular neighborhood issue. We had a young individual, a young boy, who unfortunately was killed due to gun violence in Ward 3 at the end of September and was a member of the Bernie Custis Secondary School community. And our community has been grieving not only for the loss of this young boy and his potential and what he could have achieved, but also in the community having another young person succumb to gun violence. So I'm encouraged by this motion, absolutely support it. Familiar with Operation Ceasefire, also very familiar with some of the incredible, innovative, groundbreaking work that's come out of the city of Toronto that has been very much youth-led, and specifically for those communities that have been historically marginalized in those support systems, and the work that the City of Toronto has done through their youth violence prevention and intervention portfolio, and the need for that kind of innovation and being very much centering the needs of young people. So appreciating what both Director Chase and GM Mater has offered in terms of that youth strategy and really embedding it within a youth-led and youth-centered focus. Because it's not for us adults to figure out, right? It's about identifying the needs of young people and hearing from them about their experiences and figuring out how we need to shift our systems and supports in order to meet them where they're at and support their positive futures and positive contributions in their communities today. So happy to second it. No further questions on my part, and I'm absolutely supporting it and looking forward to the next iteration of the report back that will stem from this motion. Thank you. I'll take
Well
back the chair.
spoken, Councillor, and I'll give the chair back to you. Thank you.
I accidentally muted myself. Thank you so much, Councillor Jackson. It is ready for your approval. Electronically, is it up? Yeah, there it is. Carried. Thank you so much, colleagues.
Thank you, councillors.
Thank you, Councillor Clark. Really looking forward to the next iteration. General information, item number 13, amendments to the outstanding business list. They are before you. Any discussion on any of the items in the OBL? Seeing none, I'll take a mover and seconder to approve the amendments to the OBL. Moved by Councillor Paul, second by Councillor Clark. That carries. Any items under general information or other business, colleagues? Councillor Jackson, please go ahead.
Thanks, Chair Nan. Under other business, just two things. If Senior Administrator Holly Odiarty of Macassa Lodge and Wentworth Lodge is hopefully still with us, I would like, if she has, I'm fingers and legs and toes crossed. Good news, I hope, from Macassa Lodge regarding the outbreaks of the staff and the residents there recently. Is she still with us, Chair Nan, through you, please?
She's certainly still on the call. Go ahead.
There she is. Holly, any fingers, legs, toes crossed, any positive updates, please?
Through the chair to Councillor Jackson, Holly O'Doherty, Senior Administrator, Macassa and Wentworth Lodges. In consultation with Hamilton Public Health today, we were able to declare our outbreak over. So thank you for that question. Yes, very happy day
Wonderful.
for our residents, families, and most certainly for the efforts that our frontline team members have done over the past 24 days has been remarkable.
Wonderful. And just piggybacking on that, not a question to you, Holly, Chair Nan, you and I as council's appointees to the Seniors Advisory Committee, I'm just putting the rest of my colleagues of ECS on alert that at the next ECS agenda, there's a very important resolution that was unanimously approved by Seniors Advisory Committee just on their October 1st meeting that mandatory COVID vaccinations at Macassa Wentworth Lodges. And I'm sure we'll have a full discussion when that is placed on the next agenda. And Holly's fully aware of it and has already provided some feedback as to the vaccination rates of staff at both homes. Thank you, Chair Nan.
Thank you, Councillor Jackson. Councillor Pauls.
Well, I just want to say thank you to Holly because she always keeps me as a Ward 7 counselor for Macassa. This morning we had a conversation and I knew that it was over and everybody was safe. And I really appreciate your calling me and keeping me updated. So thank you, Holly.
Through the chair to Councillor Pauls, thank you for your commitment and your inquiries about how it's going at the home and anything that you can do to support our residents, families, and staff. Thank you.
Thank you.
Thank you. Thank you, colleagues. That brings us to the end of our agenda. Item 15 is adjournment. And may I please have a mover and seconder to adjourn this meeting? Moved by Councillor Jackson, seconded by Councillor Pauls. Please indicate your vote electronically. There we are. Thank you so much. And that motion carries. Thank you again, staff who've worked to support this meeting. Thank you to the general public who was in attendance and viewing online. Take care, everyone. Have a good, safe Thursday.